Welcome to everybody today on the 22nd of June. I'm so pleased that you're here joining us today. My name is Leslie Arnott, and I am the Consumer Partnerships Lead for the Women's Health Research Translation Network, and I'll be facilitating the second of our CCI trilogy series, which is entitled Curiosity Didn't Always Kill the Cat, How We Can Be Eternally Curious About Working with Underserved Populations. But first and foremost, I'd like to acknowledge the traditional owners of the lands upon which we meet today. On behalf of WHRTN, I acknowledge the Aboriginal and Torres Strait Islander people as the custodians of the lands on which we live, learn, and work, and we pay our respects to their elders past and present. We take this time to recognize and honor the collective wisdom of Indigenous women/people in this land and those who have gone before us. We look to their collective wisdom in guiding our work and seek continued partnerships as we work together to improve health outcomes for all women and people living in this land. I'm coming to you from the lands of the Wurundjeri Wurrung people of the Kulin Nation here in Victoria. I'm very excited about this session today as it will be led by three wonderful women who will share their knowledge, which is formal as well as experiential, about what's important when working with underserved populations and how we can perhaps enable our own curiosity to connect with and build relationships with the rich communities of our varying cultures across our land. You will have read their bios beforehand, so I don't need to go through that, but suffice to say, I welcome Aman Al-Dasuki, Malavika Kadwakar, and Dr. Levita D'Souza, who will help us all develop our own curiosity about working with underserved populations as partners in research. I'll just come back to there. The other thing too is that Aman and Malavika have taken into account your questions, which you posed during your registration time. So hopefully they will be incorporated in our presentations today. So what's in store for us today? Aman will start us off, followed by Malavika, and then Levita. Then we'll have a Q&A session where we'll have the opportunity to ask our presenters some questions. And if you think of any questions during the presentations, feel free to pop them in the Q&A box. And if you've got any comments, please put them in the chat box. And Amy, who's helping me facilitate today, will monitor those. And then I'll conclude with just a gentle reminder about our final CCR webinar, which will take place sometime in September. So without further ado, I invite Aman to kick off our session today. So welcome to Aman.
Thank you, Leslie. I also would like to acknowledge the traditional owners, for as a migrant woman, I also benefited from the colonization of this land. And what a wonderful opportunity to be in this space with these amazing humanitarians, all of us. And the reason that I chosen my bit to be meaningful connections with researchers is like my approach towards all this work is for it to be meaningful. This is how you don't get burnt out and stay informed and curious, hey? So next slide, please. The one with the Jordanian proverb.
Sorry, man, I'm just
no worries.
working for some reason, it just doesn't want to go for me.
No worries. I can just talk about it. So
Okay.
there's a Jordanian proverb that says, see me with one of your eyes and I will see you with both of my eyes. This is the best way I could translate it. But basically, it's not about the act of seeing literally. It's more about, you feel seen when you are respected, when you are valued, heard, and supported. And when someone, make you feel this way in the universal spirit of reciprocity, you would give it back to them gladly. And I feel like this is a one effective way to build respectful and meaningful connections. even for researchers, even for everyone. And I have personally experienced it in my personal and professional life. So how we can build meaningful connections, and I feel like this is important, especially for researchers. And this is like the hill that I'm gonna die on. It's like there needs to be an acknowledgement and some respect to other people's experiences and to their values and to their knowledge. Respect goes a long, long way. And while it is a broad concept, but I wanted to communicate a gentle reminder that affirming people's values, norms, and aspirations is a form of respect. Acknowledging the distinctiveness of differences of our widely diverse community groups is also a form of respect. And people are not empty vessels that needs to be filled. We can, leverage on their experience. And another way to show your respect would be being transparent. Sometimes the drive behind a research or a study may not align with the core values of people, and that's perfectly okay. You need to be transparent about your intentions, and you need to ensure that after they participate, they do not regret it because you had something. And also balance the power. As we said, they are experts too in their life or in many areas of things, and you are an expert too. So create this space to collaborate and to exchange ideas, and also come with curiosity to learn more. Sometimes we go in with a task, but if you are open, you would touch on something that is extremely important. Next slide, please. Your curiosity is your superpower, and trust and believe, as a migrant, I was curious before I came here. I remain curious, and guess what? It informed my work. It informed my approach towards the world. And how you do it, just make it easier for yourself. Start with scoping. Who is doing what work? When did they do it? So you don't have to reinvent the wheel. Work smart and not harder. But also exposure. So if you are finding yourself working with a certain group or you're unpacking a certain thing, just be in that environment, be around them and feel the energy. And this way you are learning things that you did not intend to learn even. And follow people and orgs. So you learn a lot when you're following someone and when you're engaging with them. And this will show them that this person is genuine, is not just reaching out because they need something. It's a connection. It's a meaningful connection. We celebrate their wins and we allow them into our world too. And subscribe to e-newsletters. You would be amazed of how many organizations are working hard month after month to produce a newsletter. And in the future, they might be happy to share your research, or if you need participants for a study, engage, be authentic. If they're celebrating something, congratulations, be there. Let them know your face and your name, and collaborate and consult. If you are, let's say, developing a resource or something like this, and it's in another language, translation is not the only thing that you're seeking. Hire a cultural consultant so people, when they receive your work, will actually use it and it will resonate with them. And think of practical ways to support. See what is under your sphere of influence and support people. Next slide, please. Be courageous, call it out. So be really curious about what you are calling evidence-based in your research and in your work. Have we really got everyone on the table? Have we consulted with all the elements of this society fabric? And if someone is doing it, it was like in a friendly way, it doesn't have to be bumping heads. It was like, hey, maybe not all of them. Let's be courageous and say, I am researching this ethnic group, and in this ethnic group, there is this group of this age, Be in detail. This is courage. This is advocacy in action. Next slide, please. Please reimburse your consumers. If you are getting paid to do your work and you're spending time, your participants and the people you're engaging with are doing the same. It's so nice. And believe me, some people, when you are empowering them and telling them how they are, helping transformative change, I experienced that. They told me, keep your money. I just want to get my voice out. Thank you for giving me the opportunity, but always offer it. And also offer communication options. So you are making it accessible for them to participate. Face to face, some people don't like it. God bless the introverts. Allow them to speak to you on the phone. You will still get the results as well. And please give us intersecting data. I am in this working stage where I'm reading lots of studies, and too much mainstream data is not helping. It's okay. And this comes from the courage and curiosity. Next slide, please. Oh, yes, this one. When you paint the big picture, foster a sense of unity. So this is not just a participant in front of you. When you tell them how they are driving transformative change, how there's an issue, we are addressing it together. When you tell them, I will stay in touch, I will tell you what comes out of this study. And this way, you are really empowering people. You're making them feel that they are part of a solution. And this is meaningful. Next slide, please. Be consistent and stay connected. Don't tell them, I will let you know what comes out of this, and don't respond again. Guess what? You might need them again. Keep this relationship going and refer your colleagues to this person if they can help them too. Next slide, please. And you might not see directly the effect of your work, but if you really zoom out and look at the rippling effect in the water, your work is helping many people and organizations make real change. I've been working on reading so many research and data and all these things. And there's, for example, this dude in Dandenong, this is what they call them in this sector. And he has this amazing database. And we all go in there and we love him. We've never met him, but we love him. We appreciate him. And we're looking for a way to support him. Be that dude in Dandenong guy. Your work is driving change. Next slide, please. These are some resources. I'm a bit biased, but I really adore and respect NCWH approach towards research. They have great best practice guides. They love to partner, but also there's this one fresh out of the oven from the Victorian government, communicating multicultural communities. It's called A Better Guide to Communicating with multicultural communities, not best. Best has not been achieved yet. And many great people, great brains put their heads together and created it. So I highly advise you to view it and use it. And that's it for me. Thank you very much.
Thank you, Iman. Let's now get curious about how to work with undeserved populations and how to involve consumers and communities in the work. So I'm Malvika and I come from India. I speak Hindi, Marathi and English. Obviously, the languages you speak helps. I have been a health promotion officer and now I'm working as a strategic lead gender equality. So let's just go in. Next slide, please, Leslie. Thank you. Let's step into understanding what principles help when you are engaging with the communities. This is how we engage and work with the multicultural communities across KC catchment, but it will help overall. So the first principle is we are led by communities and we build on their strengths. It's important to understand who are we working with diverse range of communities, who are we working with and who are we not working with. How do we learn and build on the strengths? Because there are a lot of skills that multicultural communities have. How do we harness those strengths? And how do we ensure that these communities have the ownership and buy-in? That's how they will support the research that you're doing. When they understand you're doing something to benefit them, that's how they will learn. Are we listening to and aligning with the communities? That's important. Are we listening to them? Next principle is we take intersecting forms of oppression, discrimination, and privilege into account. Now, it's important to understand that our identities are like, peels of onion. I may be a person of color with ability, with a disability, or I may have a gender diversity, I may not be binary or I may be non-binary, and I may also speak different language. I may stay in rural area or regional area. How those identities or how those aspects create barriers or create privileges. So we need to know all this when we are researching communities. So always understand who is most marginalized within those marginalized groups. It's important. And how we identify and see how are these communities facing the barriers and how do we center their perspectives and their priorities in what we do. So once we understand those priorities, that's how we will build our research on. So it's important to understand the intersectional data. Next slide, please, Leslie. Leslie, can I have the next slide, please?
Sorry, it's frozen on me again, Malavika. But keep going, and I'll go out of it and I'll come back in again.
Okay, no worries. I'm just opening up the presentation. Please hold on for a moment.
I just have a bit of trouble with my computer. Just one sec.
The next principle is we recognize and challenge power dynamics, including our own. It's important to understand who holds the power in what circumstances. So a woman can be a manager in a workplace, but can have difficulties making a decision at home. So we need to understand who makes the decision, who is accountable, and how are they accountable, and critically reflect on personal biases and attitudes and beliefs that are hold. For example, when we work in multicultural communities, sometimes that's my personal lived experience. People questioned, how do you have so much knowledge? Can you speak English? Oh, you have qualifications, but they don't work in Australia. Are they bogus? And those sort of attitudes or biases can hinder the work that you do. So it's important to understand your power dynamics, challenge your own assumptions. That's how you will engage better within the communities. Critically reflect. That also, who are you researching with? If you have those biases, you may have a homogeneous group. You may not want to work with intersectional, or heterogeneous group with different race and backgrounds if you have those biases. So it's important to keep a check on your attitudes and unconscious biases. Next is, does privilege and discrimination, it's not the next slide, Leslie, previous slide, please. The next principle is we understand that one size does not fit all. So obviously, it's important to know that if there are so many identities, our research has to be tailored to the needs and priorities of those communities. One size will not fit all. We need to also draw on evidence and diverse knowledge that people have, and especially those with lived experiences of inequality. Now that can run in many ways. Uh, um, it can run in maybe, just a moment. Yep. How can we meaningfully engage with heterogeneous groups? So, for example, when we are sampling, whether we are encouraging those lived experiences to be part of our research is very important. And the ones who basically do not speak English, are we putting them in, are we engaging with those communities, is something that we need to understand. We consider accessibility and reasonable accommodations. Now, in some of the questions, there was someone who asked about NDIS. So when we are working with people with different abilities, are we making sure they have the access to all the, are there screen readers? Are we making sure the personal accommodations are taken care of? Are we providing transportation? Different forms of accommodations or accessibility is what we need to always keep in mind. We respect and uphold the dignity, choice, and autonomy of people. So always understand who is sharing the perspective and who is not, who has the full control over their life and who does not. For example, if I am privileged, if you connect with me, I will obviously connect you with those populations who are marginalized and may not have those privileges. So it's important to uphold their choice, autonomy, and self-determination. If you're working with First Nations, it's important to understand their self-determination when you're including them or working with them in research. Next slide, please, Leslie. Thank you. Okay, this approach is based on my work experience and expertise when I'm engaging with multicultural and undeserved populations. So it may not be there in any of the papers or any of the books. It's my experience. So as this webinar is about curiosity, didn't always kill the cat. Be genuinely curious. How will you show that? Is through verbal and non-verbal communication when you're engaging with the groups. Go in as a blank slate, take in all the information. Don't have those biases that this group, recently one experience was shared where African women said that we are not taken seriously by police when we report domestic violence is because African gangs are common. It's common to have violence, in that's a bias. That's not correct, So always have that, genuine. Don't have that assumption. Be genuinely curious what's happening. That's how you will build the trust. Trust is important, and trust is, for First Nation community, trust has been it's not easy to develop that trust with them. They have been they don't trust anyone, because their knowledge has been taken, and there has been no transparency. And like how Iman explained, don't take it and leave it. Be transparent. Close the feedback loop. Check your unconscious bias and assumption. This is back and forth. You have to go back and forth. You may not get it in the first time. You have to have that time, patience, everything. So check on your unconscious bias. Understand the impacts of colonization. For example, resume. I have had 200 resumes due to the structured way, like how you get a job here. You have to have a selection criteria. You have to have a resume inbuilt with all those position descriptions. That's not how it works in a home country. I have 200 resumes. I have 200 selection criterias. That's how colonization has impacted. So we need to break that. Driving is essential. Not we don't need driving for all the jobs. We are not drivers. So leave it up to the community how they are doing the job. So understand the impacts of colonization. When you understand that, that's how you will decolonize research. What's the evidence up till now that you have? Is this heterogeneous? Is that intersectional data? Or was it mostly homogeneous samples? Did it consider the multicultural communities, the cultural nuances of other communities? Then how can you have those norms set that this is how sleep practices work? Sleep practices, if that's how the norm is, other countries where those sleep practices are not followed are the highest population ones. The children, they have the youngest population in higher rates. So how is that possible? We need to understand who wrote what, and who did the research and who set those guidelines. Decolonize research. Next slide, please, Leslie. Thank you. Once you decolonize, develop that trust, have the genuine curiosity. If you follow the steps, you will understand what are the needs and priorities of the community, and you will meet them at their level of understanding. What you think is not what they think. So always go with the community, understand at their level, go at their level and understand. How will you do that? You will use less medical jargon. You will use simple English and more community languages to communicate. Selection criteria, what is that? Nobody knows. Smart, you give your interviews in smart or answer it in smart way. What is smart? Nobody knows. So always use, we are very fond of acronyms, use simple language, use community language, and be very simple in your approach as well. Funds are always restricted. If you ask me, everyone, like now today when people are earning, there's only one income. How do you manage your house? You prioritize. You think what is going to help to sustain. Similar way, funds are always restricted, but if you use it appropriately, you find out the cohort. If you know that you're going to work with NDIS and people with special requirements, put your funds there. Use interpreters, use translators, use all those screen readers if required, and use your funds appropriately to support your research. So think, how are you going to use your funds appropriately? Identify your cohorts and reach to different organizations. For instance, in Victoria, there are so many community organizations. There is MCWH that Iman mentioned, Multicultural Center for Women's Health, and there is Women's Health in East, Southeast, North. There is in Loudon Malay and in I think in East as well. And there are other community organizations like for youth, there is Center for Multicultural Youth. There is Southeast Community Links who works with establishing communities or emerging communities. There are specific organizations for particular cohorts. Indian Care works with South Asians. Wellsprings for Women works with Middle Eastern women. Local councils like I work for, we have access. There are different departments. So if you want to do something in maternal child health, there is a department that works in that space. You need to approach those. There is Enliven, there is DG Rao, which works with First Nation community. There is NDIS specifically for people with disabilities. You need to connect with those. They all have advisory groups. They are all connected with cohorts. Once you identify your cohort, what you want to do, after you understand your needs and priorities, you need to approach these organizations to help you out with connecting with the communities and, where exactly you want to state your problem or what's the research problem or what's the problem statement is how you will understand once you engage with the communities. So I think that's about it. There are any questions, please put it in your chat and I will pass it on to Levita. Thank you.
Thank you, Malvika and Iman, for that very insightful chat. I'm taking over now, and I feel like I'm somewhat going to be reinventing the wheel and saying what they've already said, but I'm hoping I'll be able to put that in context for you using my research. So next slide, please, Leslie. So I didn't come to research at the start of my career. So I'm a lecturer and counseling psychologist, and my journey actually started as a practicing psychologist. In my career, I've always worked, at least earlier on, with children who have experienced trauma. And then now more recently, I'm working with mums in the perinatal period. And so I've always sort of understood the impact of and the importance of a parent-child relationship and attachment, the bonding between parent-child, and more so how important it is in the transition to parenthood. So if mom's not transitioning well or dad's not transitioning well, the impact that can have on the attachment relationship, but then future outcome, mental health outcomes, both for mom, dad, the family functioning, and the child. But I never fully got that till I became a mother. So as I started to grapple with motherhood and transitioning to motherhood myself, I became quite aware of the practices that I was bringing into my motherhood journey. And very often these were quite unconscious, and these had to do a lot with what I had seen growing up, right? It was moms, it was aunties, it was grandmothers being in a very collectivist culture. And then raising a child in a culture that practices so differently, but in some ways also in stark contrast to what I was doing. And I can recall several instances being told that what I was doing was wrong and somehow I was risking my child. And in particular, as Malvika mentioned, this had to do with sleep practices. So growing up, it was always around shared sleep. We always shared sleep, and we didn't just share sleep in infant, we also shared sleep with children and adults. And so I'd be lying if I was saying that the messaging I was getting from you're not just risking your child, but you're actually damaging her, didn't leave me confused and very unsettled at times. But as I reflected and as I was practicing, I started to see that this narrative was echoed even in my clients who were coming to tell me. And these were not just women from CALL backgrounds, but these were women who were just practicing different to the norm, right? And time again, I heard that when the messaging is coming from a culture that what you're doing is not okay, the first thing to go off is your confidence in yourself, your ability to reflect, be a reflective parent, but also your competence as a mother. And that has a flow-on effect to mental health. And next slide, please, Leslie. Right. So, of course, when I became a researcher, it was a no-brainer because I was then finally going to question some of these notions and these ideas in research, which appeared to be evidence-based. But I was hoping to do it in a very systematic and objective way. I'm realizing that's not always possible, but I try to be as objective as I can in this space. So my research actually spans a couple of areas, as you can see. It looks at transition to parenthood, specifically looking at fathers. Again, they're not adequately represented in research. It also looks at perinatal loss and memory making in perinatal loss. But for the purpose of this webinar, I'll focus specifically on culturally sensitive safe sleep education. To provide a little bit of context here, shared sleep, which typically means co-sleeping or bed sharing, which is co-sleeping is where you share the same room, but not necessarily the same bed with the child, or bed sharing is where you share the same sleep surface with the child, is widely practiced across the globe. Not so much in Australia and other Western countries, but the rates are slowly picking up. The guidelines around here are okay with co-sleeping, which means it's okay for babies to be in the same room as the parent, but it's not okay to bed share. Bed share perceived to be quite risky in terms of accidental suffocation. So the American Association of Pediatrics takes a hardline risk elimination approach, which says absolutely no bed sharing under any circumstance. Australia is softening down a little bit, and they've taken the message to be more in alignment with risk minimization, which means we're okay. Bed sharing is risky, but if you are going to do it, there are some ways you can do it safely. However, when you're calling a certain practice risky, right, it comes with fear. It comes with this thing of you're doing something wrong. And as a result, what we're seeing is parents who are bed sharing then being driven underground because of the stigma they're experiencing. So they don't talk to their practitioners, they're not talking to maternal child health nurses, they're lying and withholding their practices from professionals who sometimes might need to be mitigating in case of unsafe sleep practices. So my research really is wanting to look at how can we make safe sleep education culturally sensitive and inclusive. But in order to do that, we need to understand how women from cultures that endorse and accept bed sharing are currently engaging with safe sleep education as it stands. What I really want to know is what's the impact of listening to this fear-based messaging that what you're doing is wrong? How they might be doing it safely, we don't know because it's not in the research. But if they are doing it unsafely, if we are engaging in practices that may not be safe, we need to be able to mitigate that in a safe, collaborative, and respectful way, rather than say, don't do it, or what you're doing is wrong. Next slide, please, Leslie. And so in reflecting on how I go about doing it, my first thought was, where am I going to access, a population that typically is definitely not represented in research. And I remember joking with my husband saying, well, I'm just going to have to stand outside the Indian shop and recruit mothers. Like, that's the only way. I don't know what else to do. But then I attended this network event with WHRTN. And who I must meet there is Iman and Malvika. And it was a completely different networking event, but I had this on the forefront of my mind, and I reached out to them going, listen, this is what I'm wanting to do. This is where I'm coming from. This is my agenda. Can we find a way to collaborate? So in reflecting on what really helped me, I think, was really putting myself out there, not being afraid to ask, and identifying who already has access to populations that might be you might want to work with. In this case, I found the Women's Multicultural Center for Women. But in the same vein, I was also looking for who else is in the community that might have access. And so it could be a pediatrician, it could have been, a doctor's office, it could be a person working in council who has access to participants that you're interested in researching. So in the same way, I did actually also approach a pediatrician and said, listen, I need access. And a random sample, someone who is not likely to be sitting on Facebook and responding just to social media calls. I want to be able to get in the community and talk to people. How can I do this? The second principle, I think, is about fostering trust. And to foster trust, it isn't what I can get from people. It's what I can also offer. What skill set do I have that I can offer? Because why should they talk to me? Especially if they're a population that has typically not been accessed or are experiencing stigma, as we would know most women in the call, or most parents or most people in the call community would, with oppression and just their voices not being heard. Trust can take time to come by. And even though I might look like them and I might talk like them, why should they? Right? And so sometimes it is about familiarity and what can I offer you? What's my skill set here? Can I offer you a literacy session? Can I come and talk to your health educators? Can I come and do, can I give a presentation on something? So what's in it for both of us that we can, continue to work with each other and foster this collaborative relationship where both of us are equal partners. In thinking about equal partnership, it's also thinking about how you might be able to elevate your participants to a status of being equally important and equal contributing members to your research project. So it isn't that I'm the expert and I'm going in there. It's we are both experts in what we're doing. I don't know about your experience. I need you to tell me, I need you to tell me your story in the most authentic way possible. And I need to be able to listen to that with an open mind in the most authentic way possible. So things to consider is, can I employ people as lived experience consultants, in which case you would have to monetize or adjust your budget and prioritize, as Malvika said, to pay people who can be equal contributors. Can they be co-authors, for example? Can they actually help you design your survey? Can they help you check the wording of your survey? Do we need to put in more budget for maybe focus groups with the community to be able to even check that the questions you're asking are sensitive and inclusive? And always, always, always reimburse, because I know the balance between being a researcher and not, it has to be unbiased, right? So we don't want to pay people to attract only people who will come in for the money. But my experience has been, we have to respect people's time. We have to be able to compensate people for sharing their experience. And so it's working, and it's respecting people's time and respecting people's experience. And finally, as this webinar says, be curious, not just about the topic you're embarking on, but about your own biases. Even if you are part of the community, you can still hold biases. If you're not part of the community, you are going to hold biases. And these come through not just in the way you ask your questions, but in the way you are with people, the way you are interacting with them. And so if you're not reflective and not aware of your biases, it's not likely to form a long-term collaborative relationship. And finally, if there are barriers, and these might be time, these might be budget constraints, sometimes it's about each of us having a differing agenda. That's okay. Be okay about the biases. Be okay about people saying, well, actually not right now, I'm busy. And that's okay too. So don't be afraid to ask, but don't be afraid to hear a no. The worst you can hear is a no. And I often take no's as not right now. So maybe not right now, I'll try again. That's all from me. Thank you very much. Over to you, Leslie.
Thank you so much to all of you. That was just fantastic. Aman, I love that Jordanian quote. Unfortunately, we had a few technical hiccups there at the very beginning, but I will reiterate it because it's such a great quote. See me with one of your eyes, and I'll see you with both of my eyes. That is brilliant. It's such a gorgeous example of how curiosity for others leads to a willingness to reciprocate in the relationship building process that's so necessary in our co-productive work. So I can't thank you enough for that quote. It's brilliant. And Malavika, thank you for reminding us that intersectionality plays a huge role when working with consumers as research partners, and that we need to constantly look inward to check for our own unconscious biases, just exactly what Lavita was talking about. And I love the fact that there is consistency throughout your talks, that these are the things that we need to be really mindful of. And Lavita, thank you for bringing home that recurring message that trust is paramount, and that curiosity for those we partner with, and this goes for consumers as well as researchers, that fostering trust gives us a sense of equality in our partnerships, which is just so important if we are going to work effectively together. So thank you so much, all three of you. I'm going to have to stop sharing and reshare again, only because my the computer never, for some reason, doesn't want to. There we go. Can we see that again? And I shall move forward. Let's see if it works now. There we go. So this is the part where we have a Q&A section with our panel. And I'm going to get Amy to help me out here in this section, as you will have been monitoring the Q&A and the chat box. Amy, can you share some things with us there?
Yeah, thanks, Les. We had one question which Malavika kindly responded to while Levita was presenting, and it was just from one of our participants. I'm asking if you had a list of community organisations that, especially in the space of cancer support, and so Malavika's kindly listed quite a few there. If anybody else is interested in accessing that list as well too, that's in the Q&A section. Apart from that, the floor is pretty much open. If anybody would like to type anything in, we've got 3 wonderful women here who can answer your questions. So yeah.
Amy, I'll actually make a comment on that one. You and I are working together at the moment to create a database of organizations specific to WHRTN's 9 priorities. And we're looking at creating a database that has women's health peak body organizations, as well as consumer-led organizations that are in line with our 9 priorities. And we're compiling that now. And we will provide like a preliminary list for the various different jurisdictions where WHRTN is present, so that but it needs to be a living document whereby our centers can build on that list. The more and more we find the different organizations, the consumer-led organizations, as well as women's health peak body organizations, the more and more we'll be able to have a greater reach into the community. I wanted to ask Malavika a question, actually, because Malavika is the gender equality person at Casey Council. And Malavika has an extraordinary reach into the community. And indeed, this is probably a lovely segue into our final webinar series, which is about linking in with councils. But Malavika, could you share with us some of your experiences about how going into the community is advantageous in your work?
Thank you, Leslie. That's a very, very good question. From my experience, because gender equality is a topic and prevention of violence is a topic across all the population, irrespective of which country you're from, it's important to engage with each and every multicultural community that Casey has. And the approaches that I have taken has helped me to understand what those needs and priorities look like from gender equality perspective in the work that we do. For example, there was Indian population, which is above 60, elderly. They were just concerned about, we don't have the safe space to talk. Somehow our quality of life is impacted because there is a constant intergenerational expectations, and there is this friction that goes on within the family. Like the younger family, the family wants older parents to take care of their children, which they are happy to do, but sometimes that impacts their quality of life. And who sets the expectations? And are there those intergenerational talks happening within the family? Is there a communication within the family? Now, that sort of a requirement from elder perspective is what equality matters to them. They may not look at that's somewhere that their rights, their they are not comfortable with that. It's impacting their life. So understanding that from their perspective was very important. At the same time, in Arabic population, it was more on we don't have those safe spaces and we don't have language. Like people talk in such Aussie accent and such English is spoken that we don't understand. Sometimes we need to express ourselves in our own language. So then the community member who is involved, who can translate in Farsi, Dari, or who can understand that cultural context, helped me to get to get to the understanding as to what are their needs and priorities from gender equality perspective. So each community has its own. First Nation, it's absolutely going to them and understanding what are they looking for and their self-determination. It's good to not understand what you think then.
And Malavika, can you just share with me too? You did speak to me recently, and it was a lovely story as an example of going into the community about the Macedonian community. What did you actually do?
Yes.
Share with us what you did.
Yes. Thank you, Leslie. Within the Macedonian community, we were supposed to do a health education session, which was on I don't remember what was the topic, but it was on something on menopause or something on, women's health. That was the topic. And obviously it was a Macedonian community. I did not understand the language. I did not understand anything that was said in the room, but I had a colleague who did speak Macedonian. My approach was I just entered the room as a blank slate, and first thing that they connected with is their food. Food is like common, culturally appropriate food, and dance. And I'm a good dancer. So I just followed them and copied those Macedonian steps, and they were shocked. They were like, how can you dance? This is our culture and this is our dance. How can you do it? I said, that's okay. Like in Bollywood, we can do any sort of a dance, and that's fine. And I love dancing. So, and that's the only way I connected with that group. And after that, whatever I said to them, they just listened, and they came and said, when are you coming next? Because this is more information that we want to know. So those simple things, verbal and non-verbal communication.
And that group, then you gain trust there.
Yes.
And there's a relationship that's about to form there because of that.
Yes.
And then all of a sudden you have a link into a community whereby you can go in and ask them and say, what is it that we should be researching about?
Yes. Yes.
What are the answers we need to know?
Yes.
From your community.
Yes. And they wholeheartedly will support you because they know you're doing something for their benefit. If you can not understand language and still connect with them, they will wholeheartedly have that buy-in for whatever you want to do.
Aman, do you have something similar? A story that's similar like that would illustrate that? In other words, rather than saying, here's all the things that we need to do, rather we can perhaps say, here's something that we did do and it worked.
Yeah, sure. Let me begin with confirming that Malvika is in fact a great dancer. I have seen it in action. But something that worked quite well for me as a participant in the research, and it was about perinatal health. I became a mom in 2015, and I thought, and that's not too far away, like that was like a month ago. I wanted to participate. I love to participate in research, especially when researchers are just so good, And I thought I was in a headspace to talk about my experience. And during the interview, the questions were so good. They must have been formed by a psychologist. I found myself unpacking my experience all over again. I thought I was doing really well, like I'm bypassed all of the struggle. But turned out that I'm still dealing with things. I'm still processing. And during that interview, I actually felt safe to say, you know what? I am unpacking new stuff here. Can I please withdraw today? I don't feel like this will be sufficient for your interview purposes because the journey is still going. And back in the day, I would have continued and with the discomfort, but now I am empowered to say, not now. And that researcher being so ethical and professional and empathetic immediately told me, you do what you need to do. If and when you need to continue this conversation, you have my number. And that was really empowering. And this is a story that really put the dots on the letters, like we say in Arabic.
Put the dots on the letters. That's lovely. Aman, that resonates with Levita's comments about it's okay to say no, because with Levita said sometimes that just means no for today, and you may be able to address those things later if indeed you feel comfortable to do that. And how wonderful that researcher was putting themselves in your shoes to actually feel what you were feeling, to say, I support you. I see you with both my eyes. Lavita, do you have any comments to make about what we have talked about today? Indeed, in these questions that we have just answered with Malavika and Aman.
I agree with I agree with everything that they've said. I think it's important not just to see, but also to be seen. And I think that's when we need to shed our own, the barriers we hold about, I have to be this objective researcher. And I don't know if I'm being a very objective researcher, but I'm certainly aware of what's going on for me as I'm going on with my research. I'm aware of what my biases are. I'm aware, I'm constantly reflecting. So I think when you are seen as well, it helps foster trust too. And, it might be a dance move. It might be, no, not right now. It might be, this is where I'm coming from. And that's okay. It's okay to be seen too. We don't have to be sitting guarded, and because it's not authentic then.
And Lavita, you had a nice story about how you connected with Malavika and Aman. And I really like it because you almost felt like it was a bit cheeky that you tapped somebody on the shoulder to say, hey, I think I need to talk to you. Because I think what you did was fantastic. So can you just kind of elaborate on what happened? Because
sure.
this is what networking is about. This is what being part of that Women's Health Research Network and saying, oh, somebody's on a talk there. Oh, I want to get into contact with them. So can you highlight that?
Sure. I mean, I sort of briefly mentioned it in the talk, but thinking about who I want to work with, how I want to access populations that are not represented in research. I think it was a talk with WHRTN, and it was a completely different project that they were trying to network and get people together, researchers together, but they were big about community engagement. And I think Malavika and Iman both were at that talk. And I'm looking around going, who here is going to help with my research? And then I think Iman made a comment around, Multicultural Center for Women. I'm like, oh my gosh, the universe is listening to me. And so I think I texted her in the middle while this talk is going on, sent her a private message going, can you please work with me? This is what I am interested in doing. And I think I did the same for Malavika too. It was a private message I sent saying, listen, this is what I am. This is where I'm wanting to go. This is what my research is. Can we find a way to collaborate? And then we connected on email, and look what it's led to. So yeah, I guess that's where you don't be afraid to ask. Don't be afraid to tap people on the shoulder. If it looks remotely like someone you might connect with, it's okay to initiate the connection.
Yeah. Amy, I'll just ask you one last time if there's any more questions in the Q&A and or the chat box.
Yeah.
Yeah,
Les, we've got a couple that have come through, and I just didn't notice Aman had her hand up. If you wanted to,
yes.
maybe, I know we're running out of time here, but let's try and sweep through a few of these. Thanks, Susan, for your question. She's asked, is anybody using an organisation typology approach to help different organisations work together on common goals? She'd be interested to connect if so. So I'm not sure who to send that one through to.
Lavita, are you aware of anything?
No, I'm not, but I can certainly ask with my colleagues and ask around.
That's great. Perhaps that was from Susan, is that right?
Yeah, from Susan Hazel. Any of the panelists can pop a comment in there.
That's great. I was just going to say, yes, and other people from the audience can actually answer that if indeed they know the answer to that. I was just going to say that it's okay we welcome you to get in touch with us too, and we can work together to find that out. It's a great question.
Yeah, and also a bit of a background on Wharton, and for those who are potentially who potentially aren't aware of us as well. So there's also another question, and I'm sure somebody can give, I guess, what is the definition of an underserved population? What's your true definition of, and how do you work toward defining this? Malavika's first up, Aman second.
Thank you, Amy. I think undeserved populations, it's you need to kind of, those populations who find that it's difficult for them to access services. So it can be due to age, it can be due to the rural or regional aspects, or it can be within those communities who are really in financial distress. So homelessness people, even people from certain race or First Nation. So within those undeserved populations, also we need to actually go inside and see who are those. It's very easy to say, okay, age, race, or homelessness, but actually we need to research more on who are those undeserved populations. Like you might find a particular community group, but within that community group also there are few who are privileged and few who are not. So I think it's more to be researched on what that looks like. But basically age, the ones who face barriers to access any medical services, all those will come under that.
And Aman, did you want to say something else?
Yeah, like Malvika said, Indigenous Australians, people with disabilities, people living in rural areas, people who identify from the LGBTQ plus, women, but it's just thinking like these are not the only ones. There are always, they're occurring, and it's always popping up because the world is moving and because this mainstream white system was created to serve mainstream Australians, and it does not match how Australia look like now. And I like to call them underestimated communities too, because they're not only underserved, the potential is there. And I wanted to follow up on the next question is like, how can we communicate with them and how can we engage with them? The communication channel is going to differ, like Malvika said, because you might be tapping onto people who are capable to reach that communication channel. For me, there's no one set way. Every community group, because I'm approaching it with an intention, it's specific, it's courageous. I want to speak of people who can have children, who are from this ethnicity of this age, and they arrived in the last 3 years to Australia. This is how we approach it. This is like, be specific. And there are radios, obviously. There are local radios. There are Facebook groups that are closed, so you're not allowed to go in there for their protection. So you might tap into someone who might know someone. And this is why I advise you to follow people like myself and Malvika and Levita, because we have our communication channels. But come with an open mind. You might be rejected and you might need some lubricant to get in there. Yeah.
And Aman, that's what I was so pleased that you said that, because, we're to make sure that the consumers advisor advocates that sit on our communities, not only do they have lived experience and or expertise around our 9 priorities, health priorities for women, but they are well connected into communities. So Malavika and Aman were selected because they had been working with a few organizations, multicultural organizations, so they were well linked into the community. Now, Iman puts herself out there, Malavika puts herself out there, but there are individuals within those communities that do not. But it's the Malavikas and the Imans of the world that are connected into those people who do not come forward. And it's through them that we can gain trust with those communities to find those underserved populations. Because as Malavika says, we have underserved people within a community that might not feel that some people aren't underserved. Some people come from, an affluent background within that culture. So they have the ability to put themselves out, but the others do not. And they are our conduits and our respectful conduits into those communities. So I would say linking in with your multicultural centers, you'll find people like Malavika and Aman, and then they are further connected into those communities, helping those immigrant women. And on that note, let's see if my little, no, it will not. I'm gonna have to do it again. Reshare for some reason. There we go. Let's see if it'll go. Nope, doesn't want to go. Okay, so what I was going to say is I'd like to thank all the presenters today, Iman, Malavika, and Levita. I'd also like to remind our audience of our final CCI webinar, which will be about you as researchers and how you can connect with local councils to find those populations that we were just talking about that you'd like to partner with in research. I have a terrific guest next time, Deb Langridge from the Western Australia Health Translation Network. She's an expert in this space. She has worked in community organizations in the not-for-profit sector for over 20 years now, and she'll be sharing some absolutely fantastic examples of how to do that. Link in with your local communities that resonates with health improvement plans, and those communities find your underserved populations with whom you can conduct research as partners. So I'd like to thank everybody today for joining us. I have really enjoyed our time together. And I look forward to seeing you in September, which is when our next CCI webinar takes place. So thank you to all.